All right, folks, feel free to keep chatting. We're going to get started. Just want to welcome you to First Aid, our calving difficulties, recognizing them, intervening, and when to call the vet presentation, presented by the Oregon State University, Gary R. Carlson, MD, College of Veterinary Medicine. It's great to have all of you today. Thank you for joining us from across the country. My name is Jens Odegaard. I'm the Director of Marketing and Communications here at the college. At the college, our mission is to advance the health of animals, people, and the environment through inclusive and equitable education, research, and services to the public, including public outreach, just like this presentation. We currently have 346 students enrolled here at the college. 312 of them are earning their doctorates of veterinary medicine. And then we have 42 who are graduate students in our comparative health sciences program. Many of those are also dual enrolled in the DVM program. College serves the public with research and direct clinical and diagnostic services through our Lois Bates Atchison Veterinary Teaching Hospital and our Oregon Veterinary Diagnostic Laboratory. A few housekeeping notes for today's presentation. At the bottom of your screen, you can use the Q&A feature for your questions. If you don't see it, click the more dots, the three more dots, and under that you'll see Q&A. You can feel free to submit your questions throughout the talk, and at the end of the presentation, we'll get to as many as we can. Feel free to use the voting feature if you see a question that's already been entered that you would like to see answered, and that'll help it rise to the top of the question list. A quick note, we will not be able to answer questions specific to your animal. Those should be handled with your personal veterinarian, but we are happy to answer general questions about calving difficulties. I'd now like to introduce today's presenter, Dr. Jennifer Pearson. Dr. Pearson has a passion for producer education and is an assistant professor at the college. She's a leading expert in bovine medicine and is board certified through the American College of Theriogenology. Over to you, Dr. Pearson.
Thank you. Can you hear me okay? Unmuted myself, all good?
You are good.
Okay, perfect. Sometimes the button's a little bit slow. So thank you all for joining. I'm actually shocked that there are people from all across the country, which is amazing to see that we have such a large group of followers and people that are interested in this topic. This topic is actually specifically a really important topic to me. At least I have a strong passion in looking at calving difficulties and calving management. Um, this all started when I was, a resident and working in practice, and I get called out and have to deliver a calf or have to perform a C-section, and sometimes things don't go the way that we like them to. And you just sit back and try and think about those cases and wonder, is there something that I could have done different? Is there something that we could have done collectively, the producer and I, to improve our chances of having a better outcome? And that really led me actually to an opportunity that arose for me to go and do my PhD up at the University of Calgary, looking at calving management practices and looking at ways to mitigate some of the negative effects that we see that are associated with calving difficulties. So hopefully today we can instill some new knowledge on you potentially, or at least have some really great discussions talking about calving difficulty or dystocias. I realize, if we could prevent them all, that would be really great, but that's nearly impossible. So if there are ways to at least decrease some of the negative effects or at least intervene early, I think that's one of the best ways going forward to try and mitigate some of these negative effects that are associated with calving difficulties. So our outline for today, we're going to talk a little bit about what a dystocia is, how common it is, obviously cover some of the negative consequences and try and answer the why do we care question. Go over what a normal calving looks like. So some people may have never seen a normal calving, and that's okay. Well, I'm hopefully going to be able to show you a video today, and we're going to talk through that. Some of my mentors have always said, you can't identify abnormal unless you know what normal is first. So we're going to go over that. We're going to talk about when you should intervene, how to investigate the cow and try and figure out what's wrong. Go over some tips and tricks for assisting the calving. And then probably the most important part is, when do you make the decision to say, I'm not being successful, I need to call the vet, I need to get help out there. But before we get started, I have a quiz. Don't worry, it's not graded. But I just want to kind of know what everyone's experiences out there are with cattle or calving. and what type of producers you are. So for the first question, Jens is going to pop up a little question for you, and it's going to ask you how many cows you own. And so we'll just spend the next 20-ish seconds. If you just sort of click how many cattle you own, or if you own sheep and goats, great. This talk, even though I'm going to say cows and calves a lot, all the principles can be applied to our small ruminants as well. It's just everything will be mini and on the small scale for them. But everything is mostly the same. So we're just going to give this a couple seconds, let you click how many cattle you have. So I sort of have an idea of the type of producers we have out there listening today.
This is your 5-second warning. I'm going to close the poll.
And then we'll all get to see what we have. Okay, so about 30% of you don't own cattle. That's great. You're probably just really interested in this topic. We've got some small ruminant clients, some producers that have smaller herds, which fits with what we see in North America and in the US particularly. Most of our cattle herds are smaller herds. And then we do have a couple of people with some larger herds. So we've got a really nice distribution of everybody. Great. So then my next question is, have you ever assisted a calving before? And if so, kind of roughly lots or a little, or no, I've never seen it. Just again, so I can get an idea as to who we have out there listening today. And again, we'll do like 20 seconds before we close the polls.
All right, and then close it in 5, 4, 3, 2.
Perfect. Oh, almost an even, well, pretty even. So a lot of people haven't assisted a calving before. Great. Hopefully you don't have to do too many in your lifetime. There's a few that have done a few, and then many people that have done quite a bit. So good. So we've got a nice distribution of people with all kinds of backgrounds and expertise and experiences. Perfect. All right. So let's start off the talk and talk about what a dystocia is. So you may hear your vets use this terminology. A dystocia or a difficult calving is basically defined as a prolonged or difficult birth that may or may not be assisted. I'm just going to move our faces over here so we can see all the words. So that might seem a little confusing, right? Because you're like, well, it may or may not be assisted. What does that mean? So when we assist a calving, that means we have made the human decision to go in and say something is abnormal. I don't like what I'm seeing. I'm going to go in and help this cow deliver her calf. So not all assisted calvings are dystocias. A good example of that would be a backwards calf. So a calf that's coming backwards presentation, we see 2 hind feet. We do know that cows can deliver calves normally and not have any issues delivering calves like that. However, we will talk a little bit later in this session about some of the negative effects that can happen in those backwards calves. And so a lot of producers, and myself included, I like to tell producers that if they do see a calf coming backwards, I like to go ahead and assist those calvings. That cow may have been able to push it out on her own, but the chances of there being negative effects, like having a stillborn calf, a calf that's dead at birth, are quite a bit higher in those calves. So I like to assist those. And then the flip side, not all unassisted calvings are normal births. So this is where you may come across your cows out in a pasture, and you see a cow lying down and she has a dead calf behind her, right? And you might be wondering, why did that calf die? And there's some interesting research out there that supports the idea that actually most stillbirths, so calves that either die during the birthing process or shortly after, were alive at the time of calving, but died either during the calving process or died very shortly after. And those deaths were most likely associated with either trauma or lack of oxygen during that process. So we can see those, and that's why I really urge early intervention in these cases so that we don't have to deal with dead calves. Okay, so how common is it? So this is some research that I did actually part of my PhD, and this is mostly beef specific, but I can throw out some dairy numbers too if there's any dairy clients out there. So about 5% of our calvings overall are assisted. Okay, so that is again where a human has decided to make the decision to go ahead and help assist in delivering that calf. So it doesn't seem like that big of a number, okay? So then let's break it down by heifers versus cows. So heifers are actually the majority of that 5%. So our heifers are going to need more help than our cows. This is usually for a couple of reasons. One, they tend to, maybe not be as big, so we might have some fetal maternal size mismatch, so small heifer, big calf syndromes happening. I find that heifers are much like teenagers where they get distracted very easily. And so sometimes, and I have a great picture of this. I should have shared it in the presentation where, this heifer has the head and feet of a calf hanging out of her. She's trying to give birth, and yet she is focused on this other heifer who has already given birth, and she's trying to lick off that calf. So our heifers sometimes get distracted by things, which can lead to a prolonged or difficult birth. Our cows usually don't need too much of assistance, so they're a much, much smaller proportion of that 5%, but we do still see it. And this is usually where we see some of the issues where we might have breech calves or head backs or leg backs, which we'll talk about a little bit later in the presentation. Okay. The interesting though part about this, so yes, we say not very many calvings are assisted. However, the majority of beef producers are assisting more than one calving per season. So even though they might not do it a lot, they're still having to do it at least one time every year or every calving season. So it's one of those things that we want to be prepared for, we want to be knowledgeable about, and we want to make sure that we can have the best outcomes possible. Okay. So then we might be thinking, okay, well, it's not that common. We might see one a year. Should we really care about this and focus on this topic? And whenever I write my grants for research, this is the part where I have to convince people to give me money to study this. But yes, it is important. And it's important because we know that these assisted calves are often born injured, oxygen deprived, or both. And we know that those calves that have that rough start to life, they have an increased risk of failed transfer of passive immunity, so not consuming enough good quality colostrum. They have a higher risk of getting sick and a higher risk of dying in that pre-weaning period. So these calves are already starting out their lives with the book stacked against them. Okay. From the cow side, and oftentimes we forget about the cow, but we need to think about her too, because cows that have assisted calvings oftentimes have a higher risk of retained fetal membranes, or we might call that retained placentas or retained afterbirth. And that can lead to metritis, which is a uterine infection. And we know that these uterine infections and diseases lead to an increased risk of infertility and early culling from the herd. And that is important because we look at this graph. So this is some research done by my master's student where she wanted to look at what is the cost of assisted calvings for producers? Is it really that costly? And I would say looking at this, and I'm going to walk you through this graph, it is. So probably one of the biggest surprising things is this first yellow box here. So this is unassisted heifers. So first calf heifers that did not have their calving assisted. They calved on their own, no problem. I always get surprised by this number, and many other people do as well. You're losing money on those heifers, even if they don't have any problems. And, that makes sense because if we think about it, there's a lot of money that goes into producing those heifers to begin with. So we have to get the cow pregnant, we have to pay for the bull. Once that heifer is born, we have to raise her up, we have to breed her, we have to feed her. And so a lot of the literature says that, our cows, at least on the beef side of things, they're not paying for themselves. We're not breaking even, or at least we're not making money until they've had at least 4 or 5 calves that we have sold at weaning time to try and get the cost of raising that heifer in that time. So unassisted heifers are losing us money, but you can see by this red box, if we have to assist that heifer, and especially if that calf dies, we're losing a lot of money on top of that. Usually, like I said, due to a dead calf, but this can also be associated with having to cull that heifer early or having to provide treatments to both the calf and the heifer. Unassisted cows are a little bit better, but again, I'm always shocked by how little beef producers make. It's not a get-rich-quick type of industry that we're in. So if you have an unassisted calving from a cow, a mature cow, you are still going to make some money. However, if you do have to assist that calving, and again, if she loses that calf because it dies, the treatment, or we have to cull that cow because she's infertile and she's not able to get pregnant again, we're still losing quite a bit of money. So even if you didn't really worry about the health and welfare side of things, you should be concerned about the bottom dollar reasons to care about assisted calvings. Okay, so let's go over what is a normal calving. Whoa, jumping ahead fast. So we like to break up the stages of calving into 3 different stages. So stage 1 is where we start to have relaxation and dilation of the birth canal and of the cervix, and this usually ends with the breaking of the water bag that we might call it. Generally speaking, these cows maybe are a little bit uncomfortable. They start to get pretty loose in the back end. So their vulva and their ligaments start to loosen up when they walk. They kind of have a sway to them. And this can take anywhere from 8 to 12 hours. Now, this is a stage that is not the active stage of parturition or of calving. And so this we have a little bit more of a range with, but she's not actively trying to push that calf yet. She's just getting her body ready to start to deliver that calf. The important stage is stage 2 of calving. So this is where that fetus is actually going to pass through the birth canal. Okay, so the cervix and the birth canal is dilated. The calf is passed through and it's delivered on the ground. Generally speaking, that takes about 1 to 4 hours. Now, I'm going to give you some numbers that are a little bit different in the upcoming slides, because this is based on research where they actually went in and palpated cows to determine how fast it took for her cervix to dilate and get to an appropriate size, and then how long it took for that calf to pass through there. And it's not practical for our producers to be sticking their arms in cows and trying to determine every hour how progressed she's making it through her calving. And then the last stage is the one also we tend to forget about it, but the last stage is actually when the placenta or the afterbirth is actually passed. And this can take anywhere from 12 to 24 hours. I usually say if it's been more than 24 hours, she has what's called a retained placenta, and we need to think about what supportive care she might need for that. Okay. So for those of you that may not own cattle or may not have seen a calving, this is a incredibly quick video. It's why I use it in my talks, because it's only about 20 seconds long. But this is a cow that's calving. If any of you don't like to see this, you might want to look away from your screen for a little bit. But so far, this cow is in stage 2 of labor, and she has a head and feet out. And just turn off the sound. And I just want you to sort of watch what happens. I'm going to play this a second time, and I'm going to have you look at a couple of parts of it. So she's going to give some good abdominal and uterine contractions. The chest is now out, and then the hips popped out. That was a very fast calving. But if I play it again, what I want you to notice is the arch that the calf is making when it comes out of the pelvis, as well as what the hips look like when they pass through the birth canal as well. So I'm going to play it one more time. That calf is sort of arching down, and then the hips kind of come out at an angle. And that's going to be important when we talk about delivering calves a little bit later in the talk. Okay, so we sort of know about what a normal calving should look like, the different stages of how a cow should progress through that calving. Now we need to talk about when do we decide that we should intervene because things aren't progressing as normal. Okay. And so, as I mentioned before, right, that stage 2 of parturition can take anywhere from 1 to 4 hours. But again, that's based on when her cervix dilates, how that calf is progressing through the birth canal, and when it's delivered. So there's some really interesting research that was performed where they wanted to make it very producer friendly. So what are things that producers can look for to try and identify, okay, this cow is progressing normally in her parturition or her calving event, or hey, things aren't moving as fast as I would like them to. I think I need to intervene. And so for most calving, so on average, normal calvings that are not assisted, from the time that you see either the water bag or feet to the time that the calf is on the ground is about 65 to 70 minutes. So right around that hour long period, it will take for you to, like I said, first see the water bag or feet to the time that that calf should be on the ground without any assistance, without any problems that arise to either the calf or the cow. Okay. So then another question I get is, okay, well, an hour doesn't seem very long. Can I potentially cause problems by assisting too early? And there's some other really interesting research out there. This came out of the University of Guelph, where they looked at early assistance. So what they did is they broke cows up into different time periods, and they went in to check, and if the cow was fully dilated, then they would go ahead and assist these calvings at different time periods. And the earliest time they would wait between they saw the water bag and assistance was about 30 minutes. Okay, and they found no negative influence of assisting early on that calf's health or welfare. So it didn't increase the stillbirth risk. The calves were just as vigorous if they had waited a little bit longer. And then the transfer of a passive immunity, so those calves absorbing enough good quality colostrum, was also not affected by intervening early. Now, one of the caveats here, and what they noted very clearly in this study, is that they did not pull the calf early if the cow was not dilated appropriately. And so we'll talk about how to assess that a little bit later in the program, but that is something that's really important to assess before we decide to intervene and deliver the calf. Okay, so based on research, my sort of when to intervene guidelines is when the cow's not making progress every 30 to 60 minutes or we see something abnormal. So when I say she's not making progress every 30 to 60 minutes, that means if I go out in my calving pasture or my calving barn and I see a cow laying down in active labor and I see feet or a water bag, I'm going to say, okay, I'm going to write down her number, I'm going to write down the time, and I'm going to come back a little bit later, 30 to 60 minutes later, and the next time I come back, she should make progress. So that means if I see feet, okay, I want to see a head out, or I want her to be more progressed, right? If I just see a water bag, then I want to see feet coming next. If she's not making that steady progress, then something is probably wrong. And we know that if she's not making that steady progress, the risk of that calf having issues either during that birthing process or after increases substantially. So I'm going to want to go ahead, get that cow restrained in either a chute or a headlock, and go ahead and intervene and investigate. The other thing is if we see an abnormal presentation, position, or posture, and we're going to talk about the 3 Ps. These are things that I teach to my vet students as well. So if I see something that doesn't look normal, like just a head or just one leg or a head and one leg, but not 2 legs, then I'm going to want to get that cow locked up and intervene and figure out what's going on. Because if we don't, then the risk of her either not being able to calve on her own, or again, that calf dying, or the cow having severe trauma or infection increases drastically. Okay, so these are just my sort of simple rules to watch cows progress through their calving. Okay, so when things go wrong, so you have a heifer that you've been watching, we saw the water bags, you wrote down her number, you wrote down the time, you come back an hour later and she's not progressing. What do we got to do next? So that's what we're going to talk about here. So first things first, rather than waiting for the first assisted calving, before your calving season even starts, even for those early calves that like to pop out early before we even start to expect them, make sure you have your calving equipment ready to go. Make sure that you've actually opened up your box to look at the equipment to make sure it was all put away correctly. Make sure it's clean. Make sure you're not missing anything. Make sure things aren't broken. Make sure you're ready to go. It's the worst feeling when you realize you have to assist a calving, excuse me, and you can't find your chains or you can't find your handles or you're running around the barn or calling someone asking for equipment. So these are kind of the basic equipment that I think producers should have. I did create a more in-depth list that we will put in the chat a little bit later. We'll have a link for you to look at. Little bit longer list, but basically you're going to want a bucket of warm water. Okay. You're going to want some sort of disinfectant, and that disinfectant doesn't really matter what it is. It could be ivory soap. It could be chlorhexidine. It could be iodine, like povidone iodine, anything to clean that perineum so that we are trying to be as clean as possible and not introduce manure and other infectants into the uterus and cause problems for the cow. You want a good lubricant, so some sort of obstetrical lubricant or lubricant jelly that you could buy. I say not J-Lube here. This is definitely a pet peeve of mine. Producers love J-Lube, and I get it why you love it. It comes in a small little jar. It's this powdery material that you add it to water, and it turns into this perfect gelatinous lubricant. The problem with it, though, is that if we start using it during our calvings, if we decide that we need to go for a C-section and some of that material gets inside the abdomen of the cow, those cows develop a really terrible peritonitis or abdominal infection, and they end up going downhill very fast, and we end up having to euthanize them. So I say no, no J-Lube. I know it's quick and easy and very convenient, but if there's any reason why we might have to go and do a C-section, I just say don't even bother having it in the barn. It's really good for slip and slides, but not good for calvings. Um, Obstetrical sleeves. This is another one of my pet peeves. And I know, back in the day, veterinarians would come out to the farm and take off their shirts and bare arm cows to deliver the calf. I'm going to try and convince you that you should not be doing that for two reasons. One is to protect yourself. So I don't know if anyone else out there is like me. I've delivered enough calvings now that every so often I will actually develop an allergic reaction to the amniotic fluid on my arms if I'm not wearing obstetrical sleeves. So one is to protect us. Remember, our skin likes to absorb moisture. It is a protective barrier, but if we're trying to deliver a dead or rotten calf, we really don't want any of that bacteria or nasty stuff to get absorbed in our skin. So one reason is to protect us. The other, probably more important reason is we want to protect the cow. So we're all mammals. We all have hair on our arms, regardless of our grooming strategies. Okay. And our skin is also, as I said, designed to absorb moisture. And so if we're going into the birth canal, not wearing obstetrical sleeves, we're going to soak up and draw in that moisture, take it away from the birth canal. So actually make it drier. And then our hair on our arms is actually going to cause little micro tears and abrasions within the birth canal. So if we put these obstetrical sleeves on, they're made out of plastic, they're very slippery, okay? Those are going to protect the cow's birth canal and minimize trauma to that area. So use appropriate lubricant and use OB sleeves are two of my big pet peeves when we're talking about equipment. You want to make sure you have obstetrical chains and handles. A head snare is really handy if you know how to use it. I have this little picture down here at the bottom. This is actually a small ruminant one. So even those of you who have sheep and goats, they make miniature size ones as well. Same with miniature size chains to help deliver calves. And then halters and ropes or anything that we might have to restrain that cow if necessary. Okay, restraint is really important. Having to rope a cow out in a pasture and tie her to her truck is not the best outcome for us or our truck or the cow. So having a place where we can bring that cow up if possible, put her in a headlock or put her in a chute. When we're thinking about chutes, you want one that can open on the side. We don't have to run and grab the grinder to cut the cow out if she decides to go down in the chute. So thinking about, I have this bottom picture, the sides of this chute has a head catch here, and then the sides swing open. So if that cow does go down, I can get her out safely and she's not going to be injured. Okay. We want to tie the tail up. So this picture I use in my lectures because it's not appropriately tied. So the tail is out of our way, but it's tied to the chute. We don't want to ever tie the tail to the chute because if that cow does decide to go down and her tail is still tied, she could dislocate that tail. And I have seen cows that have actually had issues with their hind end and had trouble walking because of how traumatic that tail was when it was basically dislocated. So we either want to have someone holding the tail or tie the tail to the cow, whether it be to her leg or have a long enough rope to go around her neck. Okay. First things first, we want to clean the perineum. So we're going to take that warm water, we're going to take that disinfectant, and we're just going to use our hands or a cup or anything, but we just want to clean that perineum, get any manure off that we might potentially take into the birth canal with us when we start our examination. And then again, we want to start our examination with obstetrical sleeves and lots of lube. Okay. So our golden rules of calving, we always want to remember this every single time we have to assist a calving, is we want to be clean, we want to be gentle, and we want to use lots of lube. I mentioned the lots of lube because we want to make sure that we're not causing as much trauma, but we also ourselves want to make sure that we're being gentle when we're trying to manipulate these calves. And if anyone gets a little squeamish with pictures of dead animals, I'm going to show a couple of pictures next. So just sort of a warning. But these are some more traumatic pictures that we can see that can happen to calves. So this first picture is a picture of a calf where a producer tried to, it was probably a head back. They tried to grab onto the jaw and bring that head around, and they actually broke the jaw and some of the teeth are removed from there. This top picture is actually a cow that died after a difficult calving, and you can just see how bruised and necrotic her birth canal is. So it's a lot of trauma that these cows experience, especially with the difficult calving that we oftentimes don't see because it's on the inside of the birth canal. And then lastly, this is a picture of a calf that experienced a dystocia or difficult birth. We didn't see anything abnormal, so there was no broken bones or anything like that, but this calf died and they decided to remove the skin. And this is all subcutaneous hemorrhage and bruising and trauma that calf actually experienced due to a difficult calving. So even though we don't see some of these traumatic things, I mean, obviously, if you see a broken leg or a broken jaw, you're going to notice that. But there's a lot of trauma that these animals can experience just by us assisting. So we want to make sure that we're being clean and gentle and assisting in the best way possible. Okay. Okay, so now we're deciding we're going to assist this calving. So now we need to go in and investigate. So first thing you're going to do is you're going to enter the vagina and you want to identify the cervix and identify if it is fully dilated or not, or if you run into any obstructions. Sometimes our heifers can have persistent hymens, so like a film of tissue that's in the birth canal that's preventing the calf to come out. Sometimes they can have weird strands of tissue that for whatever reason were there when they were developing as calves themselves. But the big thing is we want to make sure that cervix is fully dilated. And I mentioned this earlier when we talked about early intervention. So what that will feel like is if you put your hand into the vagina of the cow and you continue to enter into the birth canal, you will go straight into the uterus and not feel any different tissue. So if your hand just slides directly into the uterus and you can feel those the placenta or the calf without any little ridge, that means that the cervix is fully dilated. If you run your hand along the wall of the birth canal and you run into a ridge of tissue or you hit a wall immediately, that probably means that her cervix is not dilated. And even if it's partially dilated, we don't want to deliver a calf against that because what can happen is when we pull that calf against that cartilaginous cervix, we cause tears and we cause trauma to the cervix. And the problem necessarily isn't that time of the calving, but if we want to try and rebreed this animal, if her cervix has a bunch of scarring and tears in it, she's not going to be able to close it normally and prevent pathogens from entering her uterus. And she's more likely to lose future calvings or not be able to get pregnant at all. So we definitely want to make sure that the cervix is fully dilated. And then we want to identify the calf. And we're going to try and identify the 3 Ps and the rule of 3. And so we're going to go through those. Another thing you can do, so this is just a little tip and trick that I oftentimes use, especially for heifers, is sometimes you'll go into the birth canal, and if the calf hasn't, progressed normally through the vagina, it might be very tight in there. And when I go to actually deliver that calf, if I'm going to deliver it vaginally, I need to make sure that I have as much room as possible. And so one thing you can do is perform the Utrecht method of dilating the vagina. Now you'll be wearing obstetrical sleeves, unlike this gentleman in the picture who's going in bare armed. But basically what he's doing, and hopefully I can show this on the video too, is he's going in with his hands and he's pushing his elbows out to the side. And he's using his forearms at sort of the 3 o'clock and 9 o'clock position to dilate that birth canal. And you just hold it for about 30 seconds, okay? And then you go top to bottom and again, push your elbows out and you're going to dilate top to bottom for again 30 seconds. Taking that extra minute to dilate that birth canal is really going to help you later on. It's going to prevent tears and trauma to the cow, but also it's going to make it much easier for you to deliver that calf. Okay. And then when I said check dilation of the cervix, so this is just a picture of a reproductive tract. So this cow in that this reproductive tract is from, she's not pregnant. So I have the body of the uterus here. These are the horns. of the uterus, ovaries here, but I wanted you to note the cervix. Okay, so it's tight, it's closed. You can tell kind of where the opening might be, but if you run into this, if you stick your hand inside the cow's birth canal and you feel this structure, the cervix like this, it's not dilated, and you're going to have to call your vet because we're going to have to figure out why it's not dilated and if we potentially need to go to a C-section because she hasn't dilated appropriately. Okay. Okay, so let's talk about the three P's. So the first P is called presentation, and this is basically telling me which way that calf is coming out the birth canal. So is it coming forwards? Is it coming backwards? Or is it coming transverse, which is quite rare. About 13 to 22% of all dystocias will be this. This is usually when we think about those backwards calves. And we know that those backwards calves are 5 times at a higher risk of being stillborn or either dying during the birth process or shortly after because of this. And I'm going to explain why. So if you look at this picture, let me find my mouse. The umbilicus is right about here, right about where those toes are. So when this calf protrudes through the birth canal and that gets pinched off by the pelvic brim here of the cow, where is that calf's head? It's going to be outside of the cow, right? So if that calf, all of a sudden the umbilicus cuts off the blood supply and it needs oxygen, that calf can start to breathe air in the environment because its head is outside of the birth canal. If we look at the backwards calf, okay, we've got the 2 hind limbs here, and the umbilicus is right here. When that umbilicus gets pinched off by that birth canal, where's the head of the calf? It's still in the uterus, right? And that calf only has several minutes before it runs out of oxygen and it can die. So when I see a backwards calf, I do tell my producers to go ahead and intervene and assist because the chances of that cow not progressing normally and that calf dying because of a difficult birth increases quite substantially because of that. The weird one I mentioned, the transverse. So this is where you might have 4 feet coming, or you might just feel the backbone of the calf. Usually these are pretty tough to get turned around, and so usually these go straight to a C-section, but you might occasionally run into these. The next P is going to be position. So this is going to be the relation of the fetus, so it's backbone related to the pelvis of the cow. So is it right side up? Okay, and I've included the doctor terms here if any of you are interested in that. So dorsal sacral. Is it upside down or is it kind of tilted off to the side? Okay, so we've got a nice picture here of our right side up calf. This calf should be able to make this really nice arch as I showed you in the video to come out through the birth canal. If that calf is coming upside down, you can see how the curvature of that calf's back is not going to form and follow the birth canal of that cow. And so she's probably going to have issues or not be able to deliver this calf on her own because this calf is coming upside down. So we definitely want to notice that and intervene. Okay. And then the last P is posture. So this is what the fetus, the calf's legs and heads are doing in relation to its body. And this is where you see the issues like the head back, the leg bent at the knee or the leg back, or a true breech. Okay. So we've got a couple pictures here. This is a head back, fairly common. I tend to think this occurs because the cow hasn't dilated appropriately. And so the legs make it through the birth canal, but the head runs into that partially dilated cervix or birth canal. And as the uterus keeps pushing that calf through, the head gets stuck and then the head gets turned back. So this is a fairly common abnormal posture of the calf. Sometimes we have a leg back like this picture. A true breech. So a true breech is where you don't have any hind limbs. You just go in and you feel a tail. And I always caution owners to make sure that you're feeling a tail. Sometimes ears can feel very similar to tails. So double check and make sure that this is actually the back end of a calf. And they can either be where the legs are stretched up underneath the abdomen, or sometimes they're in sort of this little dog sitting presentation. And then twins, especially if you're dealing with small ruminants, these are twins or triplets or quads or quints potentially are always an issue, but we do see these in cattle as well. And the biggest thing is trying to figure out which legs belong to who and who you're going to deliver first. So following the leg up, identifying the body, and then following that other leg to make sure that you have 2 legs that belong to the same animal is really important when you're trying to decide how to deliver twins. Okay, so we're getting ready to pull. So the rule of three is really important. So in order to pull that calf vaginally, and in order for it to be delivered vaginally, you have to have two limbs and either the head or the tail that are in a normal position and belong to the same calf, integrated into the birth canal. So we cannot pull a calf that just has its head and its leg. It's too wide. It's not going to fit. It's going to cause a lot of trauma to that calf as well as a lot of trauma to that cow. So in order to decide that we want to pull it, we have to make sure that we have two legs and a head, or if it's coming backwards, two hind legs and the bum of the calf. Okay, so that's our rule of three. The next question is it going to fit? So again, we want to make sure that we have the rule of three, so the two legs and the head or the tail, and then we want to make sure that we can advance that calf's body up into the pelvic canal. So that means if we were pulling a calf that's coming forwards, that the shoulders, the head, and the legs can all be advanced into the birth canal at once. Okay. If I can't barely get that calf into the birth canal, or I can't fit the head plus the shoulders, it's not going to fit. And we have to take it out through the side door and do a C-section. Okay. The other thing you might be able to do to determine if there's enough room is after you advance that calf into the birth canal, run your hand along that calf. Now, it's probably going to be tight, especially if it's a heifer, but you should still be able to get your hand around that calf while it is in the birth canal in order to deliver it. Okay. And then we're getting ready to pull. So proper chain placement is really important. We always want to make sure we have two loops of chains on that calf's leg. Okay, so we want to place one chain above the fetlock and one chain below the fetlock. Okay, so we've got one loop here, one loop here. The reason why we don't want to pull a calf with just one loop is because that's going to provide way too much force on that one area. And we see a lot of calves delivered with broken legs because of that. So by adding the two loops above and below the fetlock, we're actually distributing that force that's applied to these calves, which can be quite a bit. I measured some of these forces on some calving studies that I've done, and these calves can experience 300-400 pounds applied to their body just by us using a calf jacker or pulling them. So we want to make sure we minimize as much trauma as possible. The other important thing about the chain placement is you can see the loops are on the top of the leg. Okay, so both of these links are at the top. We can be on the top of the leg or on the bottom of the leg, but we don't want to be on the outside of the leg. If the links cross at the outside of the leg, that is where the pressure points of that force are applied, and we're more likely to fracture those legs there than if the chain links are applied on the top and the bottom. Okay. One way to make your life a little bit easier when pulling calves is to perform a seesaw motion. So if you look at this bottom picture, okay, the width of this calf's shoulders, if we pull straight on both legs, is pretty wide, right? However, if I pull one leg, advance it in front of the other, I'm actually making that calf narrower and much easier to deliver it through the birth canal. So how we do this is we'll pull on one leg. Okay, pull it out a couple of inches, keep tension there, pull on the other leg, and again, perform this seesaw motion of back and forth slowly to help kind of wiggle that calf out and make it as narrow as possible as it comes through the birth canal. Hip lock is another thing that we oftentimes run into, and it can be quite devastating when we're pulling a calf and we think everything's going well. And then what happens is the hips get stuck against the pelvis of the cow. So if you see this first picture, this is a cow's pelvis. Okay. Her back is up here and her abdomen is down below. And then this is a cross section of a calf. So again, you can see the top of the calf and the bottom of a calf. If you look at the widest portion of that calf's hips, it's going to be across from hip to hip. However, if you see where the narrowest part of a cow's pelvis is, it's the same way. It's across horizontally. So nature does this for us, but if we are delivering a calf, we want to follow what nature does, and we want to twist that calf about 45 degrees before those hips are engaged in the pelvis. So just like this picture. So now the widest portion of that calf's hips are now coming through the widest portion of that cow's hips, and we're less likely to have a hip lock. And again, it's going to be less traumatic and much easier for us to deliver that calf vaginally. Okay. Now the big thing is when to call the vet. Okay, so I've given you some ideas about how to go in and investigate, when to intervene. But then you need to make the decision, I've been trying long enough, or I don't know what I'm feeling. Now I need to make the decision to call my vet. Okay. So if you go in and you're unsure if you're what you're feeling, and we do sometimes have weird cases, right? We have calves with extra legs or inside out calves, or maybe you just hit a wall of tissue and you're unsure if she's dilated or not, call the vet. Okay. It's going to be much better to intervene early. And if we do have to perform a C-section, the outcomes are going to be much better as far as getting a live calf and having a live cow if we do the C-section earlier than if we wait too long and mess around in there and cause a lot of trauma. And again, if the calf gets to the point where the umbilicus gets cut off and it dies in utero, we're going to have more problems there. The other thing is thinking about how long do I try and manipulate this calf before I decide I'm not making any progress, I need to call the vet. And so my rule of thumb is usually 30 minutes. So if you go in there and you realize it's a head back and you're struggling and you spend 30 minutes and you can't get that head placed appropriately to meet the rule of three and deliver that calf, you need to call your vet out. That doesn't mean call the neighbors, call the other neighbors, wait several hours, see how many arms you can get in there, because the more times you have people going in and out of that birth canal, every single time you go in and out, you're causing trauma. Okay. So that's going to increase the risk of problems for the cow, but also the calf. So if you're not making progress, again, it might be one of those things where we even go in and say, yep, this calf isn't going to be able to be delivered vaginally. We need to do a C-section. Better outcomes are going to happen if we intervene sooner. And then lastly, again, if the calf doesn't fit. So if it doesn't meet our rule of three, we get the calf positioned, we have a head, we have two front legs, and we just cannot get it advanced into that birth canal. Rather than going and dare I say this, I have heard of and seen producers who have tried to use mechanical advantage like tractors or quads to deliver calves. That never ends well. Never use that. It's way too much force. You break the calf and kill the calf, and you end up killing the cow because usually the pelvis breaks as well. So if you cannot deliver it, if it's not going to fit, it needs to come out through the side door. Okay. And then lastly, just some quick little tips about thinking about what we should do after we get the calf out. So we need to remember the cow, and the biggest thing is to check for spares and tears. And it's probably one of my favorite sayings, spares and tears, because it rhymes. But we need to go back in and make sure that there isn't a twin hiding in there. I've had producers shocked because they have delivered a 100-pound calf, and then they went back in and found another 100-pound calf. Some of these cows can carry big calves in there. So we don't want to be the person who forgets to go back in and check. And then you have to look at the cow and say, it's been a couple days. She smells kind of funny. What's going on? And then we realize there's a dead, rotten calf in there. That's not good for anyone. The other thing is to see if there's any tears, right? So maybe she's had some trauma to her birth canal that you might need to consult with your veterinarian about how to address that. Okay. And then for the calf, I could probably spend another hour talking about post-calving calf care, and we might do this in the future as well. But really important, when you deliver that calf, we need to sit that calf in sternal recumbency. I call it calf recovery position. That's what this top picture is showing. So we've taken those hind limbs and we've pulled them up by the ears, and that's going to stabilize that calf. We don't want that calf laying on its side because it's not going to be able to breathe appropriately and infiltrate those lungs with air. So we want to sit that calf upright. We want to clean the airways, rub it vigorously. Again, there's some other techniques that we can talk about in a later session about how to resuscitate calves. Check for a heartbeat. One thing we don't want to do, and I will admit I am guilty of this. I grew up doing this and now have changed my mind and become a smarter person. We don't want to be hanging these calves and lambs and kids upside down and swinging them. Okay. We used to do it because we'd hang them upside down and swing them, and we'd see all this fluid come out of their nose and mouth. And we'd say, oh, great, we're getting all this fluid out of their lungs. We're doing something good for these calves. Well, we've actually realized that fluid is actually coming from their stomach. It's not actually coming from their lungs. So that's just normal fluid, amniotic fluid that they swallow while they're in birth. It doesn't cause any harm being in their stomach. And when we hang them up upside down, you can imagine all of their intestinal contents are now pushing against the lungs and making it even harder for them to breathe. So rather than hanging calves upside down and swinging them, put them in the calf recovery position. It helps them inflate their lungs a little bit better, helps them breathe a little bit better. Again, we can talk about stimulation at a later time, but that's going to be the better way to start to resuscitate these calves. Okay. And with that, we can take some questions. I know I went a little bit long. I always like to talk about this subject. I wish all my cows would tell me exactly when they were going to calve and check the little box like I have here, but they tend to wait for rainy, cold, snowy days to decide to calve. But at this time, we can take some questions and answer any questions that the audience might have.
Pearson, are you able to see the Q&A on your end? If not, I can read the questions to you.
Possibly.
If you
Technology is not my favorite thing. Hold on. Let me
down,
find.
down at the bottom of the toolbar, if you click more, it
There
should
we
show the
go. I
Q&A.
think yes, I've got the question and answer session open. Um, Great question. So this person talks about how they have a couple of cows, all calvings attended. Sometimes the birth may appear quick and easy, but the calf has meconium staining all over. Is this a sign of distress in calving? Yes, it is. So great point. I didn't bring that up during the talk. So the meconium staining, what this person is talking about, is sometimes we deliver these calves and they have kind of this yellowish brown tinge to their hair. And what that is that's meconium. So when calves are stressed during the calving process or in utero, okay, they will actually release that meconium. So that first poop that they have, just like human babies. And what that happens is it mixes with the amniotic fluid and it actually stains their hair coat. So what that's probably telling me is if I'm delivering a lot of calves that have that meconium staining, yes, they are probably experiencing a prolonged or difficult calving. And we're stressed during that process of calving for sure. Um, Next question, if we don't have a chute, should the halter rope be long enough for her to drop? Great question. So having a safe place to handle her, and again, where she's not going to run away is really important. So if you don't have a chute, even just having like a head catch that you can build into a gate. So having a place where you can restrain the head, not V-shaped, but straight shaped. So if she does go down, she's not going to choke herself. And then, some of the setups I've seen is just a head catch, and then we can push the gate against her to sort of restrain her against the wall or against a panel so she doesn't move back and forth is a great way to restrain animals without a chute. We can use a halter um, as long as we can tie her safely. The problem is sometimes, especially with these heifers, they get really nervous. And they like to swing around a lot, and it can be quite dangerous for the cow or the heifer, but it can also be dangerous for you or your veterinarian if she is moving around so much with our arms restrained within the birth canal. One wrong move or that animal drops, and you could even break your own arm. So, best case scenario is at least to have some way that we can, even if you put a halter on her and we can squeeze her up between two panels, where one could be opened up like a gate if she does decide to go down, is going to be better than nothing. Yeah. Do. My gosh, you have so many questions and I'm losing my order. Um, Okay, so if you notice a cow or heifer in a field taking too long, are there concerns about moving her up to the barn and disturbing the process where it might make more complications? So if you've already decided that it's taking too long, so you've said, okay, I see her out in the field, the water bag is out, I'm going to come back and check her in an hour, and the water bag is still out, or sometimes they suck that water bag back in. She's probably telling you that it's already taking too long and she's already having a prolonged calving. So you're probably going to have to assist anyways. Yes, if you move her up to the barn and put her in a stall. I had this happen in one of my research studies where I was trying to study unassisted calvings in related to assisted calvings, and I tried to move cows that I thought were going to be unassisted into the barn so I could video them and have them close. And all of those ended up being assisted because I ended up moving them. But if you know that she's taking too long, you probably need to intervene anyways. And rather than waiting, going ahead and moving forward with investigating and figuring out the three P's, the will it fit, and seeing if we can deliver this calf vaginally or by C-section is going to be the important next step there. Um, does the manual vaginal dilation that you showed we're jumping around. Also work for goats such as Nigerian dwarfs. It does. I usually can't get two arms in a goat or a sheep. They're just too small, but I can use my hand and kind of push my fingers apart, similar to how I'd push my elbows apart to help dilate that birth canal. Yeah, it really helps a lot. Again, minimizing trauma and also making my life easier when I do decide to deliver them vaginally. Um, what are the best ways to identify a tear? Great question. Um, so you deliver a calf vaginally and you put your hand back in the birth canal. If you feel any roughening of tissue or extra tissue that normally shouldn't be there, so if you can identify and separate the placenta from the birth canal, and you feel roughening there, that could be some little micro tears or partial tears within the birth canal. One tear that we really worry about is if the uterus tears, and we probably see that more so in our small ruminants, just because their uteruses are much thinner than our cow uteruses. And those definitely you want to call your veterinarian about that because depending on where the tear is, uh, both are not great prognosis if it's a dorsal or a top of the uterus tear versus the bottom of the uterus tear. But one is almost guaranteed that the cow is going to die, and we might have to think about euthanasia. Whereas the other one, we might be able to treat with systemic antibiotics and other treatments and have a better outcome for those cows. But how you would tell is if you run your hand in the uterus and it seems like it slips into a hole that shouldn't be there, that is a way to identify a tear.
Dr. Pearson, I had one come in the
Yes.
chat. There was some difficulty with the Q&A for this
Oh,
attendee. The
yeah.
question says, what about membrane leakage without calving that lasts longer than a day?
Membrane leakage without calving that lasts more than a day. So I'm assuming you saw, and I might need some more clarification on this, the water break or some fluid coming out of the birth canal, but you didn't see a calving. So when the water bag does break, we do need to, that does mean that cow is progressing and in that active stage of labor. And if she's not making appropriate progression, then we need to intervene because if we wait too long, if the water bag has actually burst or broken or is leaking, bacteria can get in there and the calf can die. So if you have any clarification, if I didn't answer your question correctly, please add to it. In the meantime, I will go to the next one. So this one is a question about umbilical hernias that they've had in the calf. And so there are different types of hernias that can occur. We do very rarely sometimes see a hernia at birth where the calf is delivered and we immediately see intestines coming out of the umbilicus. Those are true emergencies. Not the greatest prognosis, but sometimes we get lucky. And if we catch it and keep it clean enough, we can sometimes put those intestines back in and correct the herniation. Luckily, these are pretty rare. I will say I have heard some old tales where people have said, "Oh, the cow sucked the intestines, was licking the calf so much it sucked the intestines out of the umbilicus." That doesn't happen. It's actually a birth defect that these calves are born with this herniation and this hole in their abdomen, and the intestines come out of it. Um, I've had a couple, it's about a 50-50 chance or sometimes a little bit less of that calf surviving. And a lot of it just depends on how fast we find it and can get it corrected or how compromised that calf is. So those are tricky situations for sure. Um, uh, I'm trying to understand this question. Have you ever and how do you pump, and it says live, into a cow calving to help maneuver the calf's position if it has a leg back? So what I'm assuming you mean is, have I ever pumped lubricant into the uterus, I have for sure. I would say definitely have your veterinarian show you how to do this because you definitely don't want to cause extra trauma. But sometimes if the calving has been prolonged and things are very dry in there, I will take lubricant, pour it into a bucket, sometimes mix it with some hot water, and then use a stomach tube, like I would use on a colicky horse, and a pump, and pump that lubricant in there to help lubricate things a little bit better for me. Yeah.
You were correct. It was lube.
Okay.
Autocorrect got it.
Autocorrect, it does it to us all the time. Um, oh, this is a tough one. So how do you handle a hip lock if the calf gets there before you are able to intervene? And what do you do if the calf is engaged in the pelvis, but you cannot fit your hands around the calf? There's just not enough space. Yeah, this situation it sucks. So this does sometimes happen where, and again, I see it in some of these beef breeds that are just really heavily muscled. Um, like I said, hopefully nature usually takes its course where it twists, but once those hips are lodged and stuck within and against that pelvis and in a true hip lock, it is incredibly difficult, if not almost nearly impossible, to get them unlocked. Most of the ones that I get called out on, they're really devastating because the calf is half out of the birth canal. They're breathing, but the hips are stuck. We have tried pushing them back in. They just, because the lungs have expanded at that point and the chest has expanded, they just won't fit back in. And most times, it ends in euthanasia of the calf and a partial phytotomy, which is where we actually have to use special equipment to remove parts of the calf to get them out. So those are really unfortunate, really hard situations. Sometimes, if we can get some lube in there to lubricate things and twist that calf a little bit before it gets lodged too much. I think the most important thing is if you see a calf that's coming out, before you go ahead and pull it, make sure that you sort of know where those hips are. And if the hips are about to engage into the pelvic canal, before you go and yank on it, give it that little twist so it's at that 45-degree angle before those hips, before you pull and engage those hips into the birth canal and against that pelvis to try and prevent that. Um, And yes, so sometimes the calf is partially in the pelvis, and you just can't get your hands in there around it. And again, those tend to end poorly. Sometimes if you pump some lube in there and use lots of lubricant, we can sometimes maneuver the calf. Unfortunately, once the calf is partially through the birth canal, trying to decide to do a C-section and pull it back through the birth canal is incredibly difficult. So again, these are both poor prognosis and unfortunately don't end in the best way. I would say to try and prevent this, examining our heifers before the breeding season and making sure they're of appropriate sizes, and making sure that they're fed appropriately throughout their pregnancy and through the breeding season to make sure that they continue to grow so we don't run into this issue of big calf, little heifer syndrome. Also selecting your bulls appropriately. So selecting bulls for calving knees is incredibly important. Again, I could probably spend another hour talking about bull selection, but don't just select bulls based on their own birth weight because there's a lot of environmental factors that can affect their birth weight. Really look at those EPDs, those expected porogeny differences, the DNA or the data that falls behind those bulls, and select them for calving knees based on that. Yeah. Um, let's see here. Okay, so this is a question where they had a large calf pulled last year, and it looks like she's starting to get close to calving again, getting close to her due date. But is it true that she might potentially calve early due to a larger calf size, or? And I'm again leading into this question a little bit too. What's the likelihood of her having a dystocia again? Luckily, so there's not a lot of research, unfortunately, to look at how repeatable dystocias are. I have some personal experience with a herd that I actually did some research with where they ended up having a lot of dystocias, pulling a lot of heifers' calves. And they decided to keep those heifers. And the next year, I did another study on that farm because they had another bad year of assisted calvings in those second calf heifers. So I think a lot of that from this farm in particular that I'm thinking about um, had some issues with nutrition and selecting their heifers appropriately. They had some body condition issues there, but there's really not a lot of data to suggest that if an animal has a dystocia one year, that she's going to have a dystocia again the next year. It depends on the type of dystocia as well. You know, if it's a head back, that probably isn't the cow's fault. That's just one of those things that sometimes happens. But if her pelvis is really small, and again, she was bred to a bull who was quite large, and she didn't grow appropriately after having that calf as well, that might happen again. The reason why we don't have a lot of research to look at the heritability of dystocias is because a lot of producers they kind of have the one strike or three strike rule for their cattle. So if they have to assist a calving, okay, that's one strike. If she ends up having a retained placenta or metritis or having other issues, that's another strike. And if she doesn't get pregnant, that's kind of her third strike and she's out. So some producers make the decision to go ahead and remove those animals from the herd. So we don't have a lot of follow-up information on them. But again, it really depends on the type of dystocia and what was the the reason behind it. Sometimes cows will calve early if they do have a larger calf, but not always. I always say if you do know an exact breeding date, cows like to go up to 2 weeks early or up to 2 weeks late. They kind of do what their what their body says, and just sort of a interesting physiology point too. It's not the cow that decides when the calf is going to be delivered. It's actually the calf. So the calf is growing inside of the cow. It gets to a point where it reaches a certain size or the organs are of a certain maturity. So the gut is mature, the kidneys are mature, and it actually releases cortisol, so the stress hormone. That cortisol is released from the calf, and that enters the bloodstream and goes to the cow and actually starts the calving process. So it is actually the calf that decides when the birth will happen, not necessarily the cow, but there's a lot of factors that go into that. Yeah. And then, Jens, was there more questions in the chat that I missed?
Think we caught all those there, and I
Okay.
capped it with the questions that we got. So I think we're good. Thank you all very much for attending, joining us for first aid. I would direct your attention to the chat. I put a couple links in there. You will be able to find a recording of this presentation in the next few days at vetmed.oregonstate.edu/first-aid. And you can also find all of our past recordings as well as other resources. If you're in need of veterinary care from our hospital, I dropped the hospital link in there as well. So with that, thank you, Dr. Pearson, very much, and
Thank
we're
you.
going to end the webinar. Have a good evening.
Thank you.